Today, I will personally perform hair transplantation on Morenga and Morenga Yang, demonstrating the entire process of M-shaped and parting line hair transplantation from start to finish, so you can see it all unfold. Hello, I'm Lee Sung-jun, Chief Director of Modumo Clinic Daegu branch. Today, I've invited two very special guests. It is Morenga and Morenga Yang, to the exact. Both of them came to our clinic with serious hair loss concerns. Many of you probably wonder how a hair transplant is performed. Since it's hard to see the operating room firsthand, I'll be doing the procedure on Morenga and Morenga Yang today to show you. Therefore, I will show you the entire hair transplantation procedure for M-shaped and parting line hair loss, using Morenga and Morenga Yang as examples. First, let's look at Morenga, our male patient. As you can observe, he presents with M-shaped hair loss. His friends tease him about it, calling him the forehead king. He came to our clinic because of his concerns about this M-shaped area. Our second patient is Morenga Yang, a female whose parting line area is thinning, as you can see. Because of this parting line, she can't style her hair the way she wants. So, she's another client who came to our clinic for help. Morenga and Morenga Yang came to our clinic with these worries, but don't fret you two, I'll fix everything. Now, let's proceed with the surgery. This is the operating room. I've brought Morenga and Morenga Yang into the operating room. Hygiene is crucial before surgery. So I'll be wearing a mask and a surgical loop to proceed. I'll wear a mask like this, and when I perform the surgery, I use this surgical loop with 5.5x magnification. You can think of it as a magnifying glass, and it has a light like this. The light comes on, I'll put on the surgical loop first. Hair follicles are incredibly fine, only about 0.2 to 0.3 millimeters in diameter. And so, to make sure I don't damage the hair follicles when extracting them, I use a surgical loop. So first, I'll check the focus of the surgical loop. Focus checked. And then I'll carefully put on the sterile gloves. We have many surgical tools laid out here, but the most crucial initial step is undoubtedly hair follicle extraction. If you observe the rear, you'll notice the dark hair follicles. I will now demonstrate the process of extracting these individual hair follicles. So, the initial stage of hair transplantation involves extracting healthy hair follicles from the back of the scalp. We will now begin the hair follicle extraction for Morenga. Morenga, with M-shaped hair loss, has hair follicles here at the back. I'll take each of these hair follicles using this punch tool. This is a punch tool. I'm going to extract the hair follicles using this tool called a punch. Okay, so here's how it's done. This punch tool, you see, rotates at a high speed. It's just like a dental drill. I will carefully select each individual hair follicle and then proceed with its extraction in this manner, one by one. The orange's hard peel and soft inside mean if I go too deep, they'll all get cut. If you look here, you can see a damaged follicle. This is what you want to avoid. Next, I'm going to perform the extraction, which is the process of pulling out the harvested hair follicles, also known as extraction. And just like that, the hair follicle comes out. See, it's out. I have to pull them out one by one like this. The extracted hair follicles are placed in a hair follicle preservation solution. We have our own. I'll show you the extraction process. If you look, each one comes out. Just like this, Morenga's precious hair follicles. You have to pull them all out one by one like this. That's why non-incisional hair transplantation takes so long. Each follicle must be manually extracted. If I were doing a 1,000 follicle procedure today, I'd have to do this 1,000 times, and extraction isn't the end. As I mentioned earlier, some hair follicles could be cut or damaged, which is why we must meticulously sort and classify all of them under a microscope. Alright, now let's extract the hair follicles from Morenga Yang. You can see the follicles on the back here as well, right? It's the same process of extracting the hair follicles. Extraction stage. The hair follicles are being pulled out one by one. See the extracted follicle? We've got quite a few now, don't we? The hair follicles extracted in this manner must be carefully placed into a preservation solution to prevent them from drying out. The third critical stage in this process is creating the essential slit incisions. Slit incisions in the hair transplantation process can be thought of as the initial sketch. I'm pre-making incisions where the hair follicles will be placed, and this part is very important. That's because the final hairstyle is determined by the angle, depth, and placement of these slit incisions. Now, let's bring out the style for Morenji Gun and Morenji Yang. Okay, for Morenji Gun, we'll create a natural hairline along this M shape. Next, for Morenji Yang, I will design the hair to be denser and more voluminous along the parting line. This blade makes slit incisions. It's called a slit blade. With this blade, I will first work on Morenji Gun's M-shaped area. I'm going to create the hairline design. When making the design, I'll carefully consider and implement each angle and depth one by one with great precision. Now for Morenji Yang, I'll do the same, following the part I designed. Alright, now for the fourth step, we need to implant the hair follicles. There are generally two main methods for implanting them. The first method is to use these forceps to grasp the hair follicle and immediately implant it. The second method involves getting some assistance from a device called the keep implanter. If a person has very weak hair follicles, just inserting them can cause them to bend or get damaged, so the keep implanter is a device that helps insert them more easily. So there are two methods, and our clinic uses both of them. So first, I'll show you the method of inserting with forceps. You grab the tip of the hair follicle and insert it. This requires very delicate and precise work. You can see the hair follicle has been inserted like this. You have to carefully pick up the hair follicle, locate the slit incision, and then secure a firm grip on its end for successful implantation. You see them going in one by one. Now for the second method of hair follicle implantation. This method uses the keep implanter, and I'll demonstrate it as well. Let's take a look. First, I have to load the hair follicle into this implanter. The hair follicle is now inside the implanter. Into the slit incision I made. I insert the implanter, then pull it out. The hair follicle is perfectly in place. You insert it into the slit incision and then pull it out like this. Some female patients have very delicate hair follicles. For those with delicate follicles, inserting them with forceps could cause damage, so this implanter can assist with that. Literally, the term implant itself signifies to plant or to insert. Therefore, utilizing this implanter allows us to insert the hair follicles with slightly more ease and precision. Alright, the hair transplant is complete. Great job, both of you. As you can see, Morenji Gun's M-shaped area is now full. You can see how we transplanted each hair follicle one by one, and if you look at Morenji Yang, her parting line looks much fuller. This is what you can consider the result of hair transplantation. Although I used oranges today, the actual surgery follows the exact same process. Roughly 1 or 2 years ago, Dr. Lee Soo-young conducted a demonstration using pigskin. I'll include the link, so if you watch it, you'll understand how it's done. Today, I've taken that a step further by using an orange for my demonstration. I hope you enjoyed watching today's surgical process. As you can see, hair transplantation isn't just surgery. Many crucial steps are involved, from hair follicle extraction to microscopic inspection, then designing the transplant area, and finally, hair follicle implantation. If even one step goes wrong, the results won't be good. That's why performing the entire surgery is very difficult, and quality control is extremely challenging. Nevertheless, at Modumo Clinic, we perform these surgeries daily for patients experiencing hair loss, so you can certainly trust us with your hair loss treatment. Just like Morenji Gun and Morenji Yang, you too can regain your confidence after undergoing a hair transplantation procedure. So today, I have shown you the entire surgical procedure from beginning to end. This has been Chief Director Lee Sung-jun from Modumo Clinic's Daegu branch. Thank you.